This is a short film that looks at the provision of public services in Britain today within the context of a banking crisis, economic recession and political scandal. A huge question mark has been raised over the future of public services. So we set out to discover what the people of Britain actually thought, whether services should be publicly run or privately run. Our first stop was to visit the London regional offices of the public sector union, Unison. We asked them how important it is that public services continue to be publicly funded and publicly run.
I believe so, and I can speak from first-hand experience because I used to work in local government in a public service arena, and we were privatised, and the key thing that we noticed was the reduction in service levels to the people who were actually quite vulnerable, people who were claiming benefit, people who depended on welfare support and advice. Staffing numbers were cut quite considerably, and the overall level of service in terms of opening hours, home visits, all that kind of thing, that was reduced dramatically.
If you outsource and commission private contractors to undertake services, then not only are you handing over profits to private contractors, you're also handing over the power and the rights as to how those public services are run and who has a say about how they're run.
Next, we spoke to members of the public in Covent Garden. We wanted to find out whether the public agreed with the union spokespersons about the importance of public provision of public services.
I think, through the government, I prefer not privatised.
It's the police services around London in particular, because of the nature of the city, the crime, and the reason for that, I suppose, is because they've got the most difficult job to do all year round.
Are there any other public services that you think are important?
I suppose, again, the medical services, because they never do get paid enough.
Public transport system is much better than what we have in the States, so that's a good thing.
And do you know that the public transport system here is mostly public services?
Yes.
And you're happy?
Yeah, we've been using the tube, and it gets us around very
Good
well.
Experience.
Yes.
Great. The health service in America is completely different to what it is in the UK. In the UK, we've got the National Health Service. Can you just give us a little bit of information and your experience of the health service in America?
Yeah, I think it is very different. Here, my understanding is you go to doctors who are employed by the government and so on. There, you do have some choice, but your insurance company gives you a hard time about whether they're going to pay or not. I'm lucky enough to have an employer that provides supposedly good health insurance, but it's hard to get them to pay oftentimes. And there's a lot of extra costs, so I spend thousands of dollars a year out of my pocket in addition to the insurance premium that I and my employer pay.
So, in the UK, the National Health Service is funded mostly by the government and the taxpayer. Do you think that's a good system then?
Yes, and in the US they talk about reforming it, but they're still afraid to have what they call a single-payer system like that. And so they're moving in your direction, we hope, but very slowly.
So if the unions and the public are thinking in similar terms, what should the unions be doing now? We leave the final word with Oliver from Unison.
I think the union's role is a very vital one. Unions need to not only be making sure that they fight hard for pay rises, to make sure that staff have the money to invest back into the economy, and to make sure that jobs are maintained, and so that unemployment doesn't rise and we don't let this financial crisis affect the economy more. I think that unions also need to be fighting for an alternative economic vision, which is based on a public sector that is strong and vibrant and that provides stable and long-term employment for the entire community.